afternoon. Our names are Anna Boatwright,
And I'm Grace MacDonald.
and we will be talking about post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is defined in the DSM-5 as a trauma and stress-related disorder characterized by intrusive symptoms, avoidance, negative alterations in mood and cognition, and alterations in arousal and reactivity, which must persist for more than 1 month and cause functional impairment. To be diagnosed, individuals must report symptoms among the 4 distinct categories listed. PTSD is often associated with veterans, but also encompasses victims of sexual assault, car crash victims, burn victims, and more. Today, we're exploring the cognitive aspects of PTSD and what we can do in the future to help patients have better treatments.
PTSD causes a variety of disoriented cognitions and beliefs by the individual, some of these including overgeneralization, disassociation, and intrusive memories, to name a few. In overgeneralization, the individuals generalize their fear from a specific traumatic event to various other situations, sometimes with no direct connections to their traumatic event. Disassociation is usually a coping mechanism used by individuals with PTSD, and it is a process which the individuals disassociate from their thoughts and feelings. With intrusive memories, individuals can experience involuntary thoughts related to their traumatic event, leading to them consistently in high levels of anxiety and stress. Additionally, lots of PTSD individuals have struggles surrounding their emotional regulation, which can lead to them being unable to process their experiences properly.
We know what PTSD does to the mind, so now let's look at some of the long-term consequences. Appraisal, as explained in a cognitive model of post-traumatic stress disorder, is a cognitive evaluation we use for an event or situation that determines our emotional responses. Several types of appraisal from PTSD can cause a sense of current threat in everyday life for PTSD patients. Patients can use overgeneralization, which make normal activities seem more dangerous than they really are. They may exaggerate the probability of more disastrous events and lead to constant thoughts such as I attract danger and bad things always happen to me and my loved ones. This thinking leads to new and constant fears as well as avoidance and isolation. Common examples include avoiding driving after an accident because of the belief that there will be future accidents, and the same can be said for sexual assault victims as well, and restricting their social lives. This new consistent fear is discussed in Emotion and Cognition Interactions in PTSD, a review of neurocognitive and neuroimaging studies, which explains that a consequence of PTSD involves hyperactivity in the amygdala, the center for processing emotions, mostly anxiety and fear, compared to those without PTSD. Alongside this, the prefrontal and medial cortexes are more prone to negative and neutral emotional stimuli over positive.
Finally, experts in the field are working on new ways of finding cognitive interventions to combat PTSD. The ones that I want to highlight being extinction of fear memories and fear memory regulation. In the extinction of fear memories, patients find ways to decondition their fear response and find ways for the brain to process the individual is in a safe environment. This can be seen in exposure therapy, which gradually the fear-conditioned stimuli is exposed to the patient. Next is fear memory regulation. This works with the heightened arousal that the patient with PTSD experiences, where they seem to always be on alert. With the fear memory regulation, a process called reconsolidation can occur, which the fear memory can be modified for a brief period of time, leading to the individual not feeling so much anxiety surrounding the event. Thank you.